Hey everyone, welcome back to the Unspoken, the podcast that aims to discuss everything not discussed surrounding transplant and donation. My name is Anna Morgan Pilardi and I will be your host today from the Chris Klug Foundation. As always, I want to say a big thank you to everyone who has tuned in to this podcast so far. And if you haven't already, please follow or subscribe, depending on where you're listening. It really helps us continue to raise awareness and get this podcast in front of more people. So make sure you hit that subscribe/follow button to stay tuned with what's coming up in the world of CKF. Next, I would like to say a big happy Donate Life Month. Today is the last day of Donate Life Month. And it is Donor Remembrance Day, so we honor all of those who made the decision to register as donors and give the gift of life, and their families for supporting their wishes. So a huge thank you to all of the donors and donor families out there who help save lives and change lives as donors, as organ donors, and as tissue donors. Today we honor you and your commitment to helping save lives. This podcast is actually going to be our CKF Awards announcement podcast. So we thought, what better way to announce our 2025 CKF Award winners than by bringing back our 2024 CKF Award winners. Mark Scotch, our Hero Award winner, Denise Rediker, Bounce Back Give Back Award winner, and Abby Gray, our community champion, will be joining us to share their journeys and their stories and their connection to transplant and donation, as well as their experience with the Chris Klug Foundation and our CKF Awards. So we will be diving right into that after a little CKF in the brief. So first, obviously, a happy Donate Life Month. A thank you to everybody who has helped raise awareness and celebrate the gift of life this month. Our Read and Register campaign did incredibly. We reached over 40,000 students nationwide through the campaign, thanks to our teachers and ambassadors who supported that, as well as our three authors, Abby Gray, Lisa Bolt, and Brenda Cortez. They really helped make that program possible, so a big thank you there. Also, to all of those who got behind our Light It Up campaign and our proclamations, all of the cities, states, communities, counties, towns who supported that. It really was incredible to see the country stop and take a moment for organ, eye, and tissue donation. So a big thank you there. In this world, we never stop. We keep raising awareness each month. So coming up, we have our NASCAR Give-a-thon Day. NASCAR Foundation helps put this on, and CKF is one of the charities supported by the Give-a-thon. So if you are planning or would like to make a donation, this is a great way to do that. A number of the donations made each hour will be matched by the NASCAR Foundation. So it's a great way to make your donation go further. And just a reminder, for every $1 that you donate, we promise to reach 2 individuals about the gift of life. Obviously, 1 individual can save 8 lives. 2 individuals can save 16 lives. So a donation of $1 could help save 16 lives. So please take a moment to consider that and consider supporting CKF and our mission to eliminate the wait. If you are interested in making a donation, check out our website or NASCAR Give-a-thon to learn more. Up next, one of our CKF ambassadors, Jeremy Nicolci, will be hosting the 2nd annual Blue Ducky 5K Waddle on May 17th. This year, there will be a virtual component, so you can participate anywhere in the US. There will also be an in-person run in Springfield, Louisiana. His sister Stephanie was an angel donor who helped save 8 lives when she passed. He started the Blue Ducky 5K Waddle in honor of her. So please check it out. It's all about raising awareness for organ, eye, and tissue donation, and make sure you register. Next, we will be headed over to Kansas for the Unbound Gravel race with our 16 riders who will be taking on both the 100-mile and 200-mile races in honor of organ, eye, and tissue donation. They have done incredible work raising awareness and raising funds for the foundation. And each of them has a different connection to donation and transplant, and is so excited to help spread the message. We have transplant recipients, donor families, medical professionals. So if you'd like to learn more about their stories or show your support, please head to our website. Another event coming up in June is the Liverman 100. Ian Pooley does this race each year to celebrate his liver transplant and raise awareness. If you're interested in doing a triathlon in Denver, please check out the Liverman 100. This obviously does not even come close to the number of things that we have coming on or coming out, but just gives you a little update on all the cool and amazing projects that are going on in the world of CKF. But without further ado, I would like to invite on our guests, Denise Rediker, Abby Gray, and Mark Scotch. Thank you guys for joining us today.
Thank you for having us. We're excited.
Absolutely. So Denise, I'm going to start with you. Can you walk us through, what your heart transplant journey looked like? The good, the bad, the ugly, what got you to this point today?
Well, thank you. Briefly, my heart transplant was in 2018. Before that, I had been sick most of my life without a diagnosis. I was diagnosed with cardiomyopathy when I was 29 years old. So I lived most of my life in some semblance of heart failure and finally ended up with a cardiac arrest in January of 2018 that landed me in the hospital to wait until I received my gift of life, which was at the end. I was one of the lucky ones. I only had to wait 3 weeks for my heart. My recovery was not easy by any stretch. I had 3 open heart surgeries in a week, 2 bouts of rejection, both kinds, and a infection. And finally, 3.5 months after my transplant, I was finally allowed to go home. And after that, recovery happened. And all of a sudden, I knew what feeling normal, I guess, or healthy felt like, because I didn't know what that felt like. I thought everybody felt like me. I thought what I was feeling before was normal, but clearly it was not. And through that process and through recovery, started wondering how people pay for all of the expenses that are related to transplant that aren't covered by insurance. I just wondered how people paid for that. I mean, we could barely pay for it. And we're privileged. We just kept wondering, my family and I just kept wondering, how do other people do this? And then we realized they can't, and they don't. And, we ran into a father of a pediatric patient who lived in their car with their daughter for their post-transplant housing because they couldn't afford a hotel in the Palo Alto area. And another man who did his post-transplant housing in a really terrible hotel in not a great section of town because it was all he could afford. And then he couldn't afford food. So here he was immediately post-transplant and not eating properly and staying in a dirty hotel room. And right then we vowed to do something about it. And so we started Heartfelt Health Foundation in 2020. And since then, we have been providing post-transplant housing to patients in financial need that don't have any other access to suitable, proper post-transplant housing. We partner with hotel style or suite style hotels and short-term apartments. We also just launched a new program called Axel's Helping Hand, and that is actually to provide patients in financial need that we've worked with and some that we haven't yet with extra financial help to help them keep a roof over their head, to make a car payment, an insurance payment, to keep the lights on at home while they or their family member are recovering from transplant.
It's amazing. You guys do such great work. I'm always in awe of it. And 5 years, that's a huge milestone. Are we doing anything big for the 5-year anniversary
Of the foundation?
of the foundation?
We haven't quite planned it yet. We probably will at some point. It'll probably be tied. We do a virtual 5K around our anniversary time, so we'll probably do something connected to that.
Yeah, I feel like a big party's in order. 5 years? Yeah, I think we're on 20 something this year. It's been a while. 22, I think. I think this is 22. So 5 years, I think, was a fun one. I think they did something big. It's that first, big milestone.
Yeah. It is. And it's kind of the place where you go from being a baby nonprofit to being like a real teenager nonprofit.
Yeah. That upgraded.
Yeah.
That's awesome. Thanks, Denise. And then Abby, I'm going to come over to you. Can you walk us through your journey as a caregiver and what inspired you to, write a book about it?
Absolutely. So, my husband had a liver transplant in 2019. At the time, I was 21 weeks pregnant with our twins, and we had gone through years of struggles with him getting sicker. And just, we also went through infertility at the same time. And so, there was a lot that we were having to lean on people around us for. And so, whenever he had his transplant, we were very, very blessed that we had a huge support system around us. We had a lot of people to help us through that. And then 3 months later, twins were born. My husband was able to be there for the birth of our twins and to hold them. We actually had a unique situation where our donor was a directed donation. And so we have a very close relationship with our donor's family. And so that's where the inspiration for my children's book came. I had heard so many amazing stories about our donor, Clayton Sparks, and was inspired to write a children's book about him, about the amazing things that he did for other people to spread kindness, or we say spark kindness. And then in February of this year, I just released a memoir that goes through all of our struggles, through infertility and loss and my husband's chronic illnesses and um, all of the support that we had surrounding us and how much of a difference that made and the amazing miracles that we did receive. And so we feel like we lived our story in order to share it and to spread hope to others. And so now I'm a stay-at-home mom, a writer, an advocate, a speaker. I do what I can to just share our story with other people and to inspire hope. I also am involved in the chairman of the board for Children's Transplant Initiative here in Houston and with Life Gift, our local OPO, and just trying to, make sure that we are there supporting other people who did not have the support that we had around us through our transplant.
You guys do amazing work too. And I swear every time I go on social media, there's like a photo of you at some different event or speaking engagement. I'm like, I can't keep up with Abby.
Well, especially this month, it's been a lot, but it's been really good. And like every time I do something like that, like it reignites
Mhm.
that like my mission because it's like you meet so many amazing people. The transplant community is incredible. And so it's not a community that you want to be in, but we're very honored and privileged to have met a lot of the people that we have within the community.
Yeah, it's such a tight knit like family and everybody knows everybody and you know
Yeah,
picks each other up when you need it. Yeah, that's
love
incredible.
it.
And just to insert, both of Abby's books are amazing.
They
Thank you.
They really are. We're currently, if you want to check out the Read and Register campaign, we are currently featuring one of Abby's books, Clayton Sparks Leaves His Mark, as part of that. So check that out. We're sending them out to schools across the country as well. And I want to touch, Abby, you mentioned how Clayton's donation to Read was a little different in that it was directed. Can you speak to that for a minute? Just kind of explain what you mean by a directed donation.
So, we were going through, my husband had a lot of challenges on the transplant list. He was listed very low because his disease did not put him high. However, they truly believed that he had cholangiocarcinoma, which is very, very scary. It's bile duct cancer. And so we had started testing friends in Cleveland for living donor program. We did not have a program for living liver donors in Houston at the time. So we're sending friends up there, and a friend of a friend's family, son was in a tragic skiing accident in Colorado, and he grew up just 20 minutes from where I did. His parents, my mom, very, very gently reached out through our mutual friend and said that, her son-in-law was waiting on a liver here in Houston if they would consider a directed donation, and they did. So a directed donation means that Clayton's liver was willed to my husband. So, and of course, a lot of things have to check the boxes in order for that to be able to actually work. And they told Clayton's parents, there's a 1 in a million chance that this will work. I've never seen it work out. We'll try. We'll see. But it did. And so that's one of the huge miracles that we received. And then now we have this amazing relationship with his parents who are grandparents to our kids now. They celebrated Easter with our entire family on Saturday. And so it's definitely a unique situation that a lot of people haven't heard about, but it was a really incredible uh, miracle that it happened the way that it did.
Yeah, definitely fate. I mean, it's not being someone that's working in the industry and here's a lot of different stories. It's not one I've heard. Park, let's start off with, what that process of becoming a donor looked like. You're our Hero Award winner from 2024. So what inspired you to become a donor, to join this community, and how did that look?
Well, I think what inspired me to become a donor was my ignorance more than anything. Randomly met a guy at a bar, and story is two guys go into a bar and one guy comes out without a kidney. Well, that guy was me. Just happened to meet a guy, got to talking with him, and when he said he needed a kidney, it just entered my mind that I could do that because I had heard of other people donating. So for me, it took a personal touch, I guess you could call it.
That's awesome. And then you inspired your wife, Lynn, to become a kidney donor as well. How is that? Is
Well,
that process?
I don't know that I inspired her as much as she got informed as well. She followed me to my evaluation process, and she listened to the doctors, the nurses, the social workers, and somewhere along the process in that day of my evaluation, she said, why aren't I looking into this as well? And so she made her own decision, and I actually tried to pull back a little bit because I realized it had to be a personal choice, and I didn't want to influence her one way or the other. So yeah, so she became a donor as well.
That's awesome. And then you were a repeat offender as a liver donor as well. So can you talk a little bit about that process, your recipient and how you got, inspired to go back again?
Well, as I was learning about the kidney donation process and the need for living kidney donors, I also learned that there's quite a need for living liver donors as well. And, the Chris Klug Foundation obviously knows all about that with Chris. But when I was talking to people at my transplant center in UW Health in Madison, Wisconsin, they had an age limit of 60 years old. And I just thought that was kind of a national thing. But then I found out, kind of by accident again, that Keck Medicine of USC will go to 70 years old possibly. They just look at the individual's health and not so much the age. So I got evaluated, just like I tell other people to do about kidney donation. First step is to get evaluated because you really don't know if you can be a donor until you do that. And I found out that I could, but I could only donate to an infant the way my liver was structured. So my piece of my liver, my sliver of my liver as I call it, went to a 9-month-old little girl from Phoenix who is registered at Children's Hospital of LA. And she's over 2.5 now, and she's doing fantastic. Yeah, it worked out great.
That's awesome. And so that whole process, you didn't just stop there. You kept going and decided, to spread that message even further through the organ trail. And that's, where we learn about you and through the foundation. What is the organ trail for somebody who's never heard about it? What does that mean?
Well, before I even learned about kidney donation, I've always liked to ride bike. I've been a mountain biker for 20 plus years probably. And I had to question, can I go back to mountain biking after I donated a kidney? And it was a real question. I didn't know. And I found out I could. But I think really what inspired the Oregon Trail was when I read that 13 people die every day waiting for a kidney transplant. That just seemed so that I didn't know that. My wife didn't know that. So in my pursuit to keep riding my bike after I donated, I wanted to ride to Louisiana because that's where my voucher recipient lived. So 7 months after my donation, I was planning to ride from Wisconsin to Louisiana. And I thought, well, as long as I'm doing that, why don't I try to create awareness? My wife and I realized that this is a solvable problem, we think, and I think many other people think that too, if we could just educate more people. And there's plenty of donors potentially out there that are healthy. So the Oregon Trail was inspired just from that fact that we knew that there was a need and we think it's a solvable problem. And another aspect of the Oregon Trail is just to demonstrate that, hey, you can be a living kidney or liver donor and save someone's life and still live a completely normal life afterwards.
Yeah. Which is the norm. The norm is you go back, you jump right back into life and you live it to the fullest, if not better, because, you have this incredible experience to back you up as well.
Normal's kind of relative, I guess.
Better than normal.
Yeah.
And so you're currently on a ride right now. You were just telling me you're in Provo, Utah. So where did you start? Where are you finishing this ride?
Well, this ride kind of represents my liver donation. So that started in Los Angeles. So we started right in Santa Monica Beach on the Pacific Ocean. And I rode from Los Angeles to Phoenix. That's where my liver recipient lives. Then we went to Las Vegas to try to create awareness up in that big city. We had some events there to try to get media attention, to put it flatly, so we can get more of the message out there. And now I'm on my way to Salt Lake, and then I'm going to end up in Denver on May 6th.
And so if we've got any followers who want to catch you on their ride, or on your ride, how are they doing that?
Well, the best way right now is to contact me directly because I'm on the bike every day. So the best way is to call me or text me, actually, would be the best. 778-488-1996. Just go ahead and text me.
Awesome. And then they can also follow all of your pursuits on the Oregon Trail on Facebook. Am I right?
Correct. And I was just at a bike shop getting some work on my bike, and the mechanic called up the Oregon Trail, and actually it came up first. So maybe we're getting ahead of some of those zombie sites.
Love that, right? That's the hardest bit, is getting that first tag. And now I want to kind of ask about the CKF Award process and what that was like for you being a recipient of the award and coming and joining us last year in Aspen for Wine and Dine. And, can you sort of speak to your experience through it? And did you enjoy it, I guess? Denise, you want to go first?
Okay, sure. It was a blast. It was first and foremost a huge honor to be selected. I just was floored when I was chosen for the Bounce Back Give Back Award. You're putting your nose to the ground and working really hard in your little corner of the world, but it's not national, and we're very hyper local to Northern California, and you just don't think, okay, the chances of us actually winning a national award for anything is very slim. And so we were just shocked. I was shocked when we were chosen and incredibly honored. And the event itself was nothing short of magical, and was so much fun to get to go out to Aspen and see your offices and just kind of get to be with everybody that we've spent so much time with on Zoom and on phone calls and text messages and emails, that we actually, got to hang out in person. And that was a gift all by itself. Aspen's a beautiful area, and we just enjoyed every minute of our time and just treasure the memories. Wish we could come back this year because it was so much fun.
Always welcome. There's always be. Abby, you want to add to that?
Yeah, so mine, I had heard about the CKF Awards a couple of years ago, and I had nominated someone, and so I was watching this podcast last year, this Zoom. I think at the time it was what was it called?
The webinar series.
The webinar series. Thank you. And so I was watching it because I knew that y'all were going to announce. And so I was like, please tell me like the person that I nominated like was accepted and or was chosen as the award winner. And so I was watching, and his name didn't get called for the Hero Award. And then but I knew Mark and Lynn Scotch, and so I was really excited for them. And I hadn't met Denise yet, but I was looking forward to that. And then at the end, you said, and the community champion goes to caregiver Abby Gray. And I was like, what? Like, what? It was completely like, I didn't even know that I was nominated. I did not think that I was anywhere in the caliber of people that were being nominated and selected for that. And so it was just it was a huge honor. My husband was working from home that day, and I ran into him, and I was like, oh my gosh, like we're going to Aspen, and like I was selected for this award. And like it was really cool. It was very exciting, and being there with y'all, like it was again one of those things that like just solidified, like this is my mission, and this is where I need to be, and these are the people that I need to be doing it with, because everyone is just it's just an amazing community, and what y'all do for the community. The wine and dine was like unreal, Aspen, like all of it. That is not something that I think that we would have been able to do otherwise. And so it was a huge honor. Yeah. And yes, I want to come back too.
Yeah. Please do. I have this mission that one year we'll have like an alumni CKF award, like dinner out here, and bring everybody else back.
We would love that.
Yeah.
And just echoing what Abby said, one of the biggest gifts of the Aspen entire event, not just the wine and dine, was getting to meet Abby and meet Mark and Lynn in person after not meeting them in person, but knowing their story, and meeting so many other people for whom organ donation and transplantation is their mission, and helping transplant recipients and helping increase the number of people registered. That was a gift all by itself, because in what I do, I mean, I talk to a lot of transplant patients and transplant recipients, but in life, I'm the only one. In my actual life, I'm the only one. And just getting to meet Abby and Mark and Lynn, who I just consider to be like personal friends now, was an additional gift that I wasn't expecting. It was lovely.
Agreed.
I always love seeing everybody, they come and they have already done incredible, you've already done incredible things. That's why you guys were selected. But then watching that like passion grow because you've started conversations with each other and heard about each other's experience and being like, oh, I never really thought of it from that way, or, and watching that passion just grow throughout the weekend is always one of my favorite parts.
Denise introduced me to a very important person who I've worked a lot with now, who actually wrote the foreword in my memoir. And so we were able to kind of brainstorm and make some connections afterwards too. And it's just, yeah.
Yeah, it's an amazing event. It's so fun. And so with that all being said, I think we should announce this year's 2025 CKF Award winners.
This is exciting.
Right? This is my favorite part. I'm like bringing in new people to the little family. It's like the passing of the baton. Obviously, we never lose you guys as part of the CKF family, but it's kind of like that new year of celebrating three individuals who have done incredible work for the community and continually put their passion out there and spread the message and support those who need it. Always so excited to celebrate everything that you guys have done in the past from last year and this year celebrating these new individuals. So to wrap this up, can you tell us who the 2025 CKF Award winner is going to be?
Yes, I can. And she's a living donor, just like myself. I've known her for a number of years. She's also a living kidney donor mentor. She helps people like myself going through the process. She also works with and starts One Kidney Clubs all the way across the United States. And that's a good friend, Patty Graham from Denver.
Woo! Yay, Patty!
Congratulations, Patty. Well deserved.
Right? Totally well deserved. Denise, do you want to announce who the Bounce Back Award winner is going to be?
I would love to. This year's Bounce Back Give Back Award winner is a liver transplant recipient, and his name is Dr. Ahmad Anudi. Congratulations. You're going to have a blast in Aspen.
Yay! Thank you, Denise. Next up, Abby, would you like to announce our community champion for this year?
Would. So this year's Community Champion Award winner is two-time kidney recipient, Dr. Randall Stafford.
Woo! Yay! So thank you for joining, and thank you everybody who is listening in, tuning in. If you haven't already subscribed to the podcast, please do so. Congratulations to our 2025 award winners. We will be reaching out really shortly. Obviously, a huge thank you to everybody who submitted nominations or was nominated for all the work that you're doing. I always say I wish I could celebrate everybody. Unfortunately, we only get the chance to bring out 3. But please remember that you can be nominated year after year. And so please make sure you keep nominating. And yeah, thank you for listening again and have a great afternoon.